Thank you, Mayor Wu, for those reflections and your steadfast commitment to health equity in Boston. We appreciate you. Good morning, everyone. Good morning. I'm Melissa Hector. For those of you I do not know, it's really great to see a lot of familiar faces in the room today. I have the honor of serving as Director of Equitable and Strategic Initiatives at the Boston Public Health Commission. And it's my pleasure to welcome you to the next panel discussion, Mobilizing Our Communities. So to set the frame, we know that well before COVID, well before 2020, the pandemic, there were many disparities that affected a lot of our marginalized communities throughout the city. And we know that the pandemic only exacerbated those disparities. While we saw that COVID prompted emergence of new groups and coalitions, we also saw a lot of people step up and take the challenge to creating transformation, to creating change in a way that really mattered for showing up for residents. So in this next session, each of our panelists today are here to share how they created transformation through their ongoing work or in a new way that wasn't done before. And so I'm really excited to be sharing the stage with these next folks. Just want to check in though, is the stage set up the way it needs to be set up? Okay, thank you. All right. So we have a lot of folks that are joining us now as the day is continuing on. I'm going to ask kindly, if you have an empty seat next to you, if you could just intimately get closer together so that way it allows some of the seats on the edges of your aisles to be open so that as folks are trickling in as time goes on, they can fill in those empty spaces versus trying to squeeze between your knees. All right, let's regroup. If you are under the sound of my voice, we're going to start our next session. Okay, thank you, everyone. So I'm going to introduce our next four guests, community leaders from around the city. It is my pleasure to welcome Pastor Dieufort Fleurissant, also known as Pastor Keke. Pastor Keke is the Executive Director of True Alliance Center. True Alliance provides support to community-based organizations responding to the immediate needs of underserved Haitian immigrant communities. Our next guest panelist is LaShyra Nolen. Lash is the founder of We Got Us, an undergraduate and graduate student-led grassroots community empowerment project with a mission to increase access to education and healing for marginalized communities. Gladys Vega is the executive director of Colaborativa. Colaborativa is a Chelsea-based social services organization that empowers Latinx immigrants to enhance the social and economic health of their community and to hold institutional decision makers accountable to their communities they serve. And our next panelist, former Senator Dianne Wilkerson, the founder of the Black Boston COVID-19 Coalition, has been a long, focused advocate for economic and social justice, particularly as it impacts Black residents and Black businesses throughout Massachusetts. Welcome. So we're going to begin our discussion, and in the first session, throughout our discussion, we'll open it up for question and answer or reflections and remarks from the audience. Okay, so in no particular order, however you feel so inclined to respond. Why was it important to build groups and spaces specifically for addressing the impact of the pandemic in the immigrant community and Black community specifically? What are the unique challenges of meeting the needs of these historically marginalized communities? And then share some successes that came from meeting these needs. Pastor Keke.
Well, I guess I have to go first. Good morning. Thank you so much for having me. And thank you for all the colossal work that you organizers and also public servants during, especially during the past 3 years around the virus COVID that had hit our community of color so hard. So again, partnership always work, partnership always pay. And I've heard it already, partnership become an asset when you have to tackle the most pressing issues facing our communities. But we know the disparities exist right before COVID because poverty, structural racism basically hit the most immigrant communities. And speaking about the Haitian community, I know exactly how it impacts them. Understand that we are working with a mixed communities that do not have access to health or other wraparound resources. So you can't operate solo organizations. You cannot operate individual institutions by yourself. You have to partner with the different organizations, basically just to get the impact that you want, and also connecting your communities with resources. And that's what coming together as many grassroots organizations. We create the Equity Now and Beyond, okay, made of Latinos organizations, Alpha, Brazilian groups. We have African Economic Development Corporation. So those grassroots organizations serve their communities on a daily basis and know exactly the hurdles, the disparities, the situations. When we come together, we definitely get greater impacts, and I'll be talking more later about it.
Thank you.
Yeah, and to follow up on what Pastor Keke said, so I'm a medical student, and when the pandemic first came around, I was in my clinical year. And I remember the first time they told us that we should evacuate our student housing and go home or anywhere where we felt like we would be safe. But what was so interesting to me is that the custodial staff at the school did not know what was going on. So we were being told to get out of there as soon as possible, but I could already see that those individuals who were essential workers were essentially being left behind. So then when I went home, I kept on seeing all these narratives, specifically around the vaccine, about how Black folks were vaccine hesitant. But there were no conversations about the historical harms that the medical institution had inflicted on Black communities. And there was also this sense of urgency. Let's get them to trust us as soon as possible so that we can get them to get this vaccine. And the community felt that. I'm actually reading a book by Stephen Thrasher called The Viral Underclass, and he talks about how a lot of underserved and marginalized communities were treated as hosts during the pandemic. Let's make sure that they get a vaccine so that they don't harm our communities, instead of seeing them as whole people, instead of understanding that the pandemic itself was exacerbating all of the structural racism and all the challenges that existed previously. So I think that when it comes to specifically serving the Black community, we just have to look at the history of this country and understanding that our communities were being disproportionately impacted by the pandemic. And I think that as far as creating groups, it had to be done in community, as you said, Pastor Keke, and I think that that's really what our organizing was all about.
Thank you. Gladys.
I think the experience that I had was a little bit different. As soon as I kept seeing the essential workers from the produce center, from the hotels, from Logan Airport, getting sick and talking about issues and us not knowing what COVID-19 was all about, especially, many undocumented families, many new recent arrivals, they had no idea. And going to hospitals or going to government institutions was not a thing that they wanted to do. And for me, being in my office and knowing that on March 4th, I needed to close because we were already getting sick, because we provide workers' rights, tenant rights. Our office has like 200 people on a daily basis coming in, and people were, we were identifying those symptoms. But I told myself when I sent people home, let's figure out what we're doing within the next few days. But one thing that I want to be able to do is do wellness check. People don't have to open the door. They can stay inside, we can be outside, but let's knock and find out what's going on and how are people doing. Because that's sort of like the model of organizing we do. But I knew from the beginning that there was that condition, accepting that condition of continue to be ignored, continue to be marginalized, continue to be given sort of like breadcrumbs because we were the smallest city in the state, the most populated in terms of undocumented immigrants. I was like, there's no way in hell that I'm gonna accept that condition and that our community are gonna settle for less. So that is why we took the streets. We make sure that we partner with people, but when people were not responding, then we began to call them publicly. When there were no resources coming in, we called them, we shamed them. Why? Because that was a condition. Losing a life was not a condition that we were gonna accept. And for decades, we were already, when you're being discriminated, when you're being oppressed, that becomes part of your furniture. That becomes part of your norm, right? That was a condition that we were not gonna accept. And that's why we hit the street, we raised hell when we had to, we questioned authority, we denounced our federal delegation when the money was not coming to Chelsea, when we were the epicenter of the pandemic, #1 in United States. That was completely unacceptable. And we hit the streets with masks, we protested, we got everything that we needed to get done. But the solution is not about that. The solution is about, for me, the social determinants of health is a place to live, a decent place to learn, a decent place to call home, a faith place, a place that I can go to church and be with my neighbors. All those conditions are the conditions that we want to be able to build together. And from this experience of COVID-19, we need to do better when we think of public health. We need to know that public health is not just going to your doctor's appointment, getting the prescription, and that's it. It's you as a medical doctor finding out what else is happening at home. What type of conditions do you live at home? Help my families, my neighbors figure that out together. And that's where we're gonna change the conditions that on a daily basis other people with power put on us. Thank you.
Good morning, everyone. I have to say that the first panel has my mind racing. It's I think it was the perfect people to speak. I'm thinking even about the comments and questions in the context of what we just went through. My name is Dianne Wilkerson. It's a pleasure to be here. I had the distinct honor and privilege of being the founder of the Black Boston COVID-19 Coalition. But I want to tell you what that meant. It was just about a phone call. I, like every one of you, in the month of February, was watching and listening and not quite sure in 2020 what was happening. But here's what I knew, based on 45 years in Boston, 45 years, and dealing with the reality of being Black in a city that doesn't really know what to do with you, right? Hearing that this thing, I said, remember, this thing called the coronavirus, that's what it was at that time. And all we knew is that it was going to be bad. And within the first 2 weeks of the national discussion, we knew that if it's going to be bad, Black and Latino people are going to get more of it than everybody else. And that's all we needed to know what we had to do to go to work, because we've been down this road before. And so started calling people saying just that. I don't know what we're gonna do, don't quite know what this is, but I think we need to be talking, we need to be getting together. And the first week there were 4 people, next week 8, next week 12, and by the end of 2022, we had almost 500 members of the Black Boston COVID-19 Coalition. We met every single Saturday, 2-3 hours. Remember, most of that we spent on lockdown, talking about what we need to do to save lives. That was our mission, simple as it could be. What do we need to do to save lives? And I have to say that it's very rare we even get an opportunity to tell the story about what happened. So I am deeply, deeply, deeply pleased and excited to be here. So let me tell you about Boston. 150, 60,000 Black residents, almost 110 maybe thousand Latino residents, dealing with already all the social determinants of health. So we were at that time the worst. We had the worst of everything: asthma, lupus, high blood pressure, you name it. So we went into COVID, as I call it, circling the drain, and all we could say was, uh-oh. The partnerships that you talked about, remember the first conversation, hesitancy. Black people and Latino, Black people are not gonna come. They're not gonna wanna talk to us because they're hesitant because of, it's so crazy to me, Tuskegee. I know that the majority of people in my community don't know what Tuskegee is. Their hesitancy wasn't about 50 years ago, it was about 5 minutes ago. It was about the experience that they had with their doctor 1 month before this started. And so we literally went to work. It took us 4 months from March of 2020 to get the city of Boston to do a testing site in Roxbury. And in fact, I should say the Commonwealth, was the major point of operation. Here's the other thing we don't talk about. The entire emergency service delivery for COVID on a national basis and on a state basis was based on the assumption that everyone had access to the internet. It's where you had to get information. It's where you had to register. So that was our mission. We set up immediately to begin a whole new process where we went and found people. As Gladys said, we had to knock on doors. We had to go and knock and check on our seniors because no one else was going to do that. We worked with the city to make sure that in May of 2020, our seniors had a warm meal for Mother's Day. We delivered 2,400 meals on that day, and really involved all of our restaurants, from the Soleil to Daryl's to all of them. We had them delivering hot meals to our seniors, PPE'd up, and whatever we had to do. I have to tell you that while we're in the midst of this, every single week we get on, somebody was dead. Somebody was dead. My mother died, my brother died, my sister died. And we realized, how do you grieve in isolation? We called on people like Dr. Reverend Gloria Hammond to talk to us about how we process this, because we'd never been here before. No funerals, what do you do in that process? The mental health reality of what was going on. The fact that we knew, because BPS told us, that 30% of our children were not online. And we just kept moving like nothing ever happened. Never got online during the time that we were on lockdown for our schools. Our children, who already were feeling Black and Latino, the biggest racial gap in education, it only got worse during that time. So the reality is we went to work. We knocked on doors. We hired people when everybody else was going home. We hired 130 people. And their job was to knock on the doors, to stand out in the places that were still open, and give people information. And that was that first year. Remember, the first year we didn't have any vaccine. It was all about testing. But when the vaccine came, that was a whole nother reality. Again, what was the first thing you remember? 75 years and older, and you got to register online. My mother couldn't do that. Most of your mothers couldn't do that. Yeah. So this is the reality of what race played in this process and the lessons we learned. I hope we get to talk about them today, because there's a lot of good stuff that if people are receptive to it, a lot of good stuff that we can do. We have to do things differently.
Thank you. Thank you. And thank you all for so candidly sharing, so much amazing work, especially thinking about all the canvassing that we did throughout Dorchester, Roxbury, Mattapan, setting up vaccination clinics in backyards and grocery parking lots. And a huge thank to our community health center partners who are here from Upham's Corner, BMC, Greater Rosendale, East Boston, who partnered with all of our leaders here on stage to make sure that we could really do what we're calling grassroots, right? Meeting people where they're at. And so that leads to our next point of discussion. Now that we're in this, and I do a strong air quote because we know it hasn't fully gone away, but now that we're in this post-COVID era, how have you continued to implement the learnings and the grassrootsness of the work that you're doing today? 3 years later, time flies, right? 3 years later, how have you continued to implement those same best practices and really putting public health to work? I'll start with you again, Pastor Keke.
Okay. You just stated that we are not yet out of COVID, and the work must continue. And I'm just always referring to one passage: whoever knows the right thing to do has the capacity to do it, yet failed to do it, and this is sin. So the fact that we have learned so many hurdles that we had, and then build on it, and to be able to connect our community with most needed resources, being able to educate them about the circumstances that there are, they need to take advantage of it and collaborate. So by continuing to build the bridges that we already had, and then let me also add the fact that we had the success that we had through the different organizations is the opportunity that we had to receive some funding, because we could not do the kind of work that the coalition was able to do. Like CSIO was able to obtain the funding, and thank you so much, Dr. Ojikoto, to making sure that BHPC, just the OMS, put out the funding for us to do that. So let me just give you an example that Brazilian Women's Group can organize one clinic and got 100 people vaccinated. For us as the Haitian community, and Dianne can attest to that, we have to do 12. And then it wouldn't happen if we didn't have the manpower, the resources, the collaborations, the clinical providers to come on a weekly basis, 3 to 4 times, to organize those vaccine clinics. Again, the problems still arise. We still have undocumented immigrants into our population. We still have people who have no access to primary care physicians. We still have the new arrivals coming in our midst. We need to continue to have some wrap-around resources at their disposal. And this is definitely the kind of advocacy that our coalition continue to request wrap-around resources for our community wherever we go: dental screening, eye screening, routine exams, to continue to maintain the well-being and the wellness of our community. So building upon what we already did, we will continue to request the wraparound resources and continue to partner with our elected officials as well as with the hospitals to continue to maintain the level of collaboration with the grassroots organizations so that we continue to make the impact that we need to make. Let's say if we get the next virus, we just don't know when it's coming, but we'll be ready to tackle it.
Thank you, Pastor Keke. And Lash, before you go on, what Pastor Keke just mentioned, these wraparound services and why they're so crucial, working with the hospitals and the community health centers, is because that's where that primary care, right, is going to be connected from the resident to the health center around the corner from their house. And I just named a few community health center partners, but Whittier Street, Harvard Street Neighborhood Health Center, Charles Riverview and Brighton, all across the city, these community leaders worked with to make sure that residents had access at their stoops right around the corners and not have to go far in the places that felt foreign to them in the city that they've been living in for their life. So thank you for sharing that, Pastor
Don't
Keke.
forget Mattapan Community Health Center.
Yes.
Great partner working on us. Right, thank you.
Got it. Thank you, Pastor Keke. Lash.
Yeah, so the organization that I started is called We Got Us. And We Got Us is a coalition primarily led by young people across the city. And our goal was to make sure that our communities had access to information about the vaccine, and it was always coming from a space of conveying, not convincing. So we wanted to make sure that people had access to adequate information about the vaccine, but then we always put public health at the center of it, in the sense that the reason that we're here is because we did not have the infrastructure necessary to make sure that our communities were protected. So as we went out and we were having conversations with people, I'm of course coming from Harvard Medical School. So in me being in that space, I have the privilege of having access to fellowships and funding to create an initiative like this. Traditionally, the communities around Harvard Medical School does not have a good relationship with Harvard Medical School or the medical institution generally, because what happens is that our infrastructure is set up that you're more incentivized to study communities than you are to actually address the struggles that they're experiencing. So I didn't want this to be another health disparities project where I would write something up and I would keep it pushing. And also I knew that the communities that I was working with, they were like, okay, well, y'all are gonna come in here and write your paper, but then where are you gonna go afterwards? So from the very beginning, we wanted We Got Us to be a sustainable project, a sustainable organization in the community. So as we started off doing these empowerment sessions about the history of medical racism and how the vaccines were developed, and doing those virtually, based on the needs of the community, we expanded those empowerment sessions. So we now have empowerment sessions talking about maternal mortality, talking about how to protect yourself when you go into medicalized spaces, talking about chronic illnesses. And we've also launched specific programs specifically working with our unhoused communities in Mass and Cass. So thinking about, accessibility that we mentioned, we're doing a telehealth project working with an organization called Housing Equals Health. And we're basically trying to make sure that folks have access to phones so that they can use telehealth as a way to access primary care. So really, we've just been fluid in responding to the needs that the community has had as a way to, thank you so much. As a way to make sure that we're showing that we're not going anywhere. We're gonna be right here and we're gonna continue to respond to the needs that you have. And then I think the second thing that I'll add is that the reason why I really wanted We Got Us to be led by the youth is because it creates that level of sustainability. So for example, I'm gonna be applying for residency this summer, and it's incredible to see how the folks who started out with us during their freshman year of high school or their freshman year of college are now moving into director roles within the organization. We have one student that was just accepted to get her MD PhD. We have 2 students studying for the MCAT. So it's incredible because the other goal of We Got Us is to essentially train the next generation of Black progressive leaders in medicine and public health. So they are incredible. So I think that that's really what our goal has been, and our central message is that even though the pandemic might be waning away, the struggles of our communities are here to stay, and as long as that is a reality, We Got Us ain't going nowhere.
I have to add that one of the things that we did just a bit different is that I remember when East Boston Neighborhood Health Center came looking for a space for the vaccination, we were renovating that space at 318 Broadway. Because remember, I created a supermarket in front of my house on March 5th, and then I created a free supermarket in our office. So I moved the desk, put pallets of food, and then we serve 11,000 people a week, providing food and using food also as a wellness checking in. But when East Boston Neighborhood Health Center came, it was so different because we had locally MGH already helping us. They were convincing our community members how that of why being tested and what was coronavirus like, because people in Chelsea thought that COVID-19 was a type of cholera. You know, you're about to die, you have no contact with anyone, don't open doors, etc. And it was like if someone gets sick, you lock them out of the house, change the locks, and they're not able to return. But what brought us a level of awareness, but a level of us beginning to accept, was having a clinic in our office, because we were the trusted agents, right? So that was key. That was key to have the clinics coming over to the community-based group. Also, you know, I remember vividly the administration of East Boston Neighborhood Health Center. You know, these are guys in suits and they're very community-oriented, but I'm a tough cookie to deal with. So figuring out, you know, how are you gonna allow all the people that register in their computer through the government, to the database system that the government had, right? Or just having people walk in from our neighbors, and every time I would go inside the office, I'll see all these people for Newton, Milton, and whatever, and I'm like, where's my Chelsea people? Where are my Chelsea elders? And then having those conversations with East Boston and having a true partner that was able to say, let's move it, let's change it, let's do this, anything extra, we'll reserve. They advocated for more vaccination. But for me, you know, like MGH, Chelsea, like the Chelsea Clinic was instrumental in going out door knocking with us and pair them with neighborhood people, church people, and taking doctors with their little jackets and their suits and stuff to make sure that people understand, this is the doctor. If you don't want to hear from me about vaccinating, hear it from a doctor. Aquí tenemos la doctora. I remember Joe Betancourt brought all these Latino doctors in a group, and we had over 35 doctors going into our neighborhood with members and leaders of faith. That was important. That was extremely important. So I think what I miss the most about this is that we already turned the page. After 3 years, everyone is good. All the people of color are fine. We're all educated. We have a roof over our head. We're healthy. We have it going. That is total bullshit. And I think that we need to be better. We need to be better at thinking. You know, I'm thinking of, you know, this is a conversation about health, right? And here I am going back to my office today to talk to people because we have over 300,000 people that are going to be losing their coverage, the healthcare coverage. What makes us think that we are already able to do that right away? And what is our plan? What juice did we drink that all of a sudden we got healthy and we have no problems? So let's keep that in mind. Let's continue to build a Massachusetts that is healthier because we have resources, because we're providing housing. Imagine we're taking everything out all at once. We are taking raft resources. We're taking health care coverage. We're taking food, everything all at once. That is, and for communities of color, for brown and black, oh my God, that is detrimental. We've been marginalized for decades. What makes us think that we're okay and that is okay? So please help me continue advocate and raise hell when we have to, because it's unacceptable.
Wow.
I know I have a freshman. I'm sorry.
No, I'm usually the only one. I'm glad. So here's what I think we need to think about. Gladys said we're still in the hole. It's, you know, but here, to answer the question, the Black Boston COVID-19 Coalition was by design never intended to be existent forever. What we pulled together was the coalitions, the organizations, the institutions, the city, the state partners, the healthcare partners that existed. And so we raised $2.2 million to do our work. That's significant because, as was said by Mary and Sandro in the initial presentation, God, there was just money everywhere. Money coming from, we have an incredible congressional delegation, powerful, that delivered probably more money per capita to Massachusetts, And on the state level, they were not really receptive to stepping outside the box. So we had to go out and raise money. I raised $2.2 million on phone calls. Our partner was the city of Boston. I see Chief Martinez there. They responded because they knew we knew what we were doing. When we stepped out 1 month into vaccination, so February 1st, 2021, we started in Boston, in Massachusetts. A month later, Massachusetts was 48th in the nation in Latino vaccination and 45th in the nation in Black vaccination. We went to work, and we claimed that. And we're very proud of what we did. We went and got people, and we brought them. Lyft called us. We see what you're doing. We want to partner with you. They gave us $60,000 in Lyft rides. So, because people couldn't ride on the bus. The city of Boston was our partner. CIC Health said, we don't really know how this works. We said, we do. Let us guide. We worked with Fenway Health. We developed a report initially. If you all have not read it, I advise you to read it, called We Thought You'd Never Ask, where we were interviewing and surveying people about their relationship with healthcare, and so they told us, and you need to read that. That was halfway through. In the end, we ended up, when the vaccine center closed in June, Reggie Lewis, in June of 2021, and just please don't remember that all of the talk, I remember watching the governor talk about the vaccines are coming, and we're going to be ready. We know that Black and Latino community are the most harmed, so we got to make sure that they get it. So what do? They open a vaccine center at Gillette Stadium. And I'm saying, what the hell? Who lives there? Think about that. It made no sense. And so he didn't like what we said, but we were very public about it. And so he said, okay. We're going to do one at Fenway Park. We're like, so you picked the institution with the worst history and relationship with Black people in the city. It made no sense. So do know it was the city of Boston who got us to the Reggie Lewis. I said, finally, one in our community, right? You all know what happened the first week. All the people lined up were white seniors from out of Boston. But of course, because they had children who could go online for 3 or 4 hours and get them registered. We said we don't work that way. And so I will tell you more detail, but here's the bottom line. The picture of the Black doctors that we filled on that space went viral nationally. Seniors and residents were walking into the Reggie Lewis that we drove there, we rode there, we knocked. They were crying. And what people didn't understand is they weren't crying out of fear. They were looking around and seeing people that looked like them, and they were crying. Dr. Ojakutu, you saw that. Reverend Dr. White Hammond, you saw that. That's all people could talk about. But what did it do? They went home and told them, you got to go to the Reggie Lewis. We went in 2 months from number 45 and 48 to number 5 and number 8 in the country. We drove tens of thousands of people into that space. 9 languages. We were calling Chinatown, come over here. People had issues around immigration status, so we worked out with them here. Here's what we're going to do. We're going to have people write their name on a card. All you really need to know is that they spell their name right, because people were afraid that ICE was hanging. We were able to accommodate and adjust. Not everybody liked it, but we did it anyway, because it was about saving lives. And so by the time we finished, we're getting calls from Pennsylvania, from Ohio. They're doing presentations from their state health agencies. Tell us, what are you doing? They called us, and we were sharing. We were doing presentations in New Jersey via Zoom, because it was all about saving lives. And that's just really the point, that I'm just like, doesn't anybody want to know what we did and how we did it? We have 3,200 surveys right now that we collected in the last 6 months of 2022 on how COVID affected your family's health and economically. We have the surveys, nowhere to go with them. Black Bostonians. I don't know that anybody else has. You talked about that. Nobody else has collected it. We have it. We have it. And we just got to do better. We just have to do better. We have to assist. We have to be willing to stand up and curse sometime. No, it's true, because they're not listening. If we don't do, see, you say you're ready for next time, Pastor Keke. We're not. We're gonna have to start all over again. That's the shame of it. That is the shame of it. And if we do nothing else today, I'm hoping that we can convince some of you to join the fight with us, that we gotta do this differently. We gotta do it differently.
Thank you. So at this time, such a great discussion, really, really great discussion. We have a decent amount of time in our session to open up for some questions or reflections or comments that anyone would like to share, either directly for the panelists or just to share in the space. So at this time, if you have a question or a reflection or comment you'd like to address, please feel free to come or stand, and one of our staff will bring a mic to you.
Hi, I was just wondering about your reflections on a faith-based approach to community health and how you or groups you worked with kind of incorporated a faith-based approach into vaccination and educating around COVID.
Well, thank you. Karen is a part of a coalition just with the Center to Support Immigrant Organizing. That's the organizations that brought before COVID, basically the coalition, Alpha Agencia, Brazilian Women's Group, the African Economic Development Corporation, Trinidad Center, and Haitian American United together to tackle the COVID issue, and then trying to tackle the health inequities among our communities, but now and beyond. So we definitely started April 7, 2021. That's when we got our first vaccine clinic in a church in Mattapan, Nazarene Church. And the Boston Herald said, well, HAU adopted a church. So to get the people to come in, removing all the barriers, they feel at home. And that's the way it's been happening, having those vaccine clinics in churches throughout BMC, our biggest clinical provider, traveling all the way to Worcester, to Brockton, to Lynn, to Chelsea, everywhere we go with Alpha, just organizing vaccine clinics, meeting the people where they're at. We couldn't get it done without the help of the faith-based and the pastors, basically at the pulpit on Sunday through Zooms, through teleconference line, and telling the people it is okay because we are serving an omniscient God, a God who knows about science. So don't worry. I'm not saying don't worry about it, but you need to understand, you need to trust the science. You need to trust God. If you trust the science, you trust God. You can get the vaccine. We know we have the highest hesitancy rates into our community. Ongoing education needs to be done, and it has to go through, I'm not going to all the pastors, but some pastors still feel hesitant, basically, when it comes to COVID-19 vaccine. Understand that this is the mark of the beast. That's the end of the time. We know all of this happening, so we have to continue on to do the education and partner with all the faith-based organizations and the pastors and the churches, organize those vaccine clinics at their churches, removing all the barriers, because we know that, but also request for additional incentive for our community. We talk about it all the time when we first started, okay? Having just a COVID-19 vaccine clinics will not be too beneficial to our immigrant communities unless you add other, again, wraparound resources into it and add as well incentive into it.
So I think that the churches are the structural institutions in our community. And so it's ironic because, you know, they were all on lockdown. They weren't doing services, but the pastors were very helpful. I'm a member of Morning Star, and I know that was with BMC, one of the central vaccination sites in the kind of Mattapan stretch. And yeah, we don't have time to talk about what happened with Mattapan and how they got completely left out of the whole process. I don't really quite figure, I know to this day, can't figure out what was going on there, but we targeted Mattapan because of what we saw with the numbers. We've never been in a situation where, it's one thing where you say the black residents stats are this and the rest of the city. We were, Roxbury and Dorchester, in testing and vaccination, at one point 10, 15, 20%, 20 points higher than Mattapan, which has never been the case. This should just be a study, how did that black community, which happens to be the highest homeowners black community, lag so far behind? We didn't get over 30%, I think, remember, until middle of 2021, late 2021. But the churches were a part of it. We actually had a coalition as part of the Black Boston COVID Coalition. We used that money that we were raising to incentivize. We were giving monies to our partners so that they could have people, hire people, both to get people to, to the churches or the testing sites that we were running, or when we were doing vaccination, we did that, as Pastor Keke said. So the churches were an absolute central part of the success of our effort.
I'll just briefly add that among the first emails that I ever sent was to Reverend Gloria Hammond about We Got Us, because I knew that she would have the institutional knowledge. I knew that before I did anything, that was another thing. We didn't want to do anything that the community was already doing. We wanted to collaborate. And I think that was a critical conversation, because then we ended up supporting her and doing focus groups in a partnership that she had with another institution. So it was great because, as you said, churches are our central organizing space, and they have been historically. And then she connected us with Rabbi Orr, who works for Hebrew College. So we were able to do work around interfaith collaborations, and that was central to forming our youth organization as well. So I think faith-based organizations were very critical for our organizing. So thank you for that. Would you like to say that, Gladys?
I have to add that my experience was not the same. I have to say that there were probably 2 Protestant churches that were very, very involved, but I felt that the Catholic Church was very absent when it came to COVID-related issues. I think we all prayed a lot. If anything, I found myself, I never forget April 9th, I found myself kneeling and praying, and I'm not a church going, but I had to, because I had no food, and I had 350 people waiting for boxes of food, and I had nothing to give. But I felt that with all the resources, some of the churches were handled it different. People handled this situation totally different. There were many people that were just afraid. There were many people just waiting for that big miracle. And I was like, the miracle is you doing something for your neighbor, checking on your neighbor. It's not as at home in a Zoom meeting or just praying in a rosary. It's all of us together checking on our neighbors, checking on that elder. Who's feeding them? Who's putting people in a hotel when they're locked out of their apartments? And I honestly have to say that if it wasn't for Father Edgar and Reverend Ricardo Valle, those were the main Protestant churches that were extremely, as a Catholic, my church was absent.
Thank you. Thank you for that. We have time for one more remark or reflection. If anyone would like to come forward and share. Yes, a mic right here.
Hi, good morning. I'm Damaris Velasquez, Director of Programs of Agencia Alpha, and I'm a member of Equity Now and Beyond. More than a question, I just want to amplify one of the messages that you're giving. Just like your group, Dianne, Equity Now and Beyond was able to have a research going along with our clinics. And something that I always thought is, we don't need to do more research in our community. We already know what the issues are. And those who are in high levels already know the issues that we have. My suggestion would be, we should spend money doing our research, in those who are sitting up here and are holding the resources, because we need to understand why is it that those resources are not coming down. So I agree with all of you. We need to keep on working. Let's spend money in figuring out who is the 1% that is holding all of those researches and make sure that our community is a healthy community. We know how to take care of our community. We just need to figure out who or how many are those who are not allowing us to keep on growing. And then we can come out of that hole that we're talking about. Thank you.
Thank you. Thank you so much. Okay, so our session is now coming to a close, and I'd like to wrap up with a statement question, a call to action. What would, and love to hear from all of you, what is one thing or a theme or concept that you would love for folks to walk away from? And in the space we have people from the political arena, elected officials, academia, medical professionals, students alike. And so what is one thing that folks should walk away from after listening through this session?
Well, as I stated before, with tackling the health disparities and also understand the social determinants of health that community of colors is going through, to understand that how to continue to support it. And we have a concern with the ending of the COVID-19 emergency that will be coming next month. So we would like to make sure that our community can have access to free treatment and free COVID-19 moving forward, because many of them don't have access to primary care physician or health insurance. Understand that. We would like that support to continue coming from the hospital, from the health centers, as well from the elected officials, to making sure that resources are still available. Thank you, Gladys, just to mention that our people will be impacted by the mass health redetermination. We know that's happened. They've been moving throughout. They couldn't find them, so they'll lose their coverage and not being able to access quality health care. We need to, the elected officials, as Damaris said, the people at the top, to understand the situation. We still need the assistance, the support, the funding, the resources for us to continue to maintain our health and our well-being.
I think I'll say two things. The first is that we cannot research our way out of oppression. Period. And then I think the second thing that I'll say is I spend a lot of time in classes, but I think that the answers are not within institutions, they're in the community. So we need to find more ways, sustainable ways, to make sure that the community is involved at every single step of the way in everything that we do, whether it's in business, government. I just think that what I see a lot is that we bring in community when it's a matter of convenience, to check off a box in a way so that we can continue on with the process. But I think that community members should be seen as an integral resource. And with all the degrees in the world, I think that there's so much knowledge that community members have that are far more valuable than any letters behind a name.
I just briefly want to say that that I think the future of changing the condition that we have been given in terms of health and equity, it's about raising issues on a constant basis, and it's about keeping people accountable. And it's about saying, you're my friend today, but tomorrow you didn't bring money to Chelsea, you need to do this, and you need to do it now. I think if we don't keep people accountable, they're just going to look to the side. And we cannot be in rooms being co-opted in these conversations just because. No, if I'm here, it's because you're going to invest in my community, because you're going to invest in people of color, because we've been marginalized for too long, and this has to stop. So I think that my call is, this is about life. This is about a condition that we are forced to have when we were born, but we have to change that condition, and we have the power to do it together.
I think when I thought about today, one of the things I'm hoping is that some of the key industry leaders were going to be here this morning. Because I know that I see the panels in the afternoon, or maybe they're representatives, but just, hear this. Equity does not mean giving everybody the same. We throw that word around, and I am convinced that we have different definitions of what equity means. And the takeaway that I wish that you would think about today is the timing. That for the first time in the history, really, of ever, we have a money problem. Too much of it. I never thought I would live to see an article, the headline, the Globe did it in August. Massachusetts has a money problem, comma, too much of it. December, the Herald did the same headline. Legislature is itching to get back to work to spend all those reserves. The federal government is pouring money into states. We happen to be one blessed to be getting more than most, right? The city has reserves. Even from ARPA, we talked about it. If any of the statements about the commitments to racial equity and social justice and creating wealth are real, this is the moment to actually implement it, because we have the resources to do it. But we're fighting like we're poor, like there's nothing in the kitty. And I think we have to keep reminding people that it's there. Not 2 years from now. That's the concern for me about the reparations plan. The city has a team, and they're not even supposed to do their report until the end of '24. And that report, and then it'll be 2-3 years after we get a report, right? Well, guess what? The deadline to spend the ARPA money is the end of '24. The deadline to spend the infrastructure money and all that money is coming before we even get there. So we got to have a real conversation. If we're serious about equity, we're serious about closing the health gap, health equity, eradicating the education gaps, and it's about resources, we should be in that conversation right now, because we have the money to do it.
Thank you, Senator. So I'm gonna stand when I share this last remark. So I'm gonna make a statement, and after I make this statement, I would love for you to give a big round of applause, and if you have the ability to stand, and thank this panelist for the session on today and the work that they've done. And I say that because I've been a witness over the last 3 years of all 4 of these individuals working 12 to 16-hour shifts, days, Monday through Sunday, to mobilize resources, putting PPE, food, grocery deliveries, test kits, making sure that folks have information at their doorsteps, at their fingertips, blowing up my phone, blowing up Chief Martinez's phone, blowing up Dr. Ajikutu's phone, doing the work that you need to do to hold public officials accountable to making sure that people get things where they need. I'm a kid from Roxbury, but a lot of times when we're in our administrative work, we don't always have our ear to the ground, and so we need people like this to continue helping to advocate and push and let us know where we should be looking and the work that we should be doing to make sure that we are providing that equitable access. So without further ado, thank you for this discussion today. Thank you. Thank you for your participation. So at this time, we are going to take a nice 10-minute break. Just a reminder, there are restrooms once you leave here to the left down the hall.